Welcome to Med-Surg Mini number 18, pneumonia. Pneumonia occurs when an infectious agent is inhaled. This can either be bacterial, viral, or fungal. And whatever the infectious material is, it comes in and inflames the parenchyma, causing infection. As the infectious pathogen grows, they travel to the alveoli, where the body sends protein-rich fluid and exudates to try and fight it off. This protein-rich fluid and exudates then build up the amount of fluid in the lungs, and it can impair gas exchange, which causes symptoms. Transmission is droplet, and there are different types. There's community-acquired pneumonia, which means that they have obtained it from the community. There's MRSA-related community-acquired pneumonia, where they're infected from dislocation of MRSA particles. There's hospital-acquired, which means that they got it from a hospital setting, or healthcare associated, where they got it in regards to getting healthcare. Examples of a healthcare associated form of a pneumonia would be if they're on a trach and they got an infection in the trach that led to pneumonia. This is more common in individuals that are greater than 65 years of age, and risk factors for developing pneumonia include being in a long-term care residence, smoking, having a chronic respiratory disease, being immunosuppressed, having altered mental status, immobility, aspirating, exposure to pollutants, or being in the hospital for more than 48 hours. Symptoms include fever, dyspnea, tachypnea, dysrhythmias, particular tachycardia, chills, having either a productive or non-productive cough. If it is productive, the sputum may be blood tinged, having pleuritic chest pain, fatigue, myalgia, arthralgia, hypotension, and altered mental status. Pneumonia is diagnosed through elevated lab values, such as increased white blood cells and bands, as well as high C-reactive protein levels. Arterial blood gases would indicate respiratory alkalosis. In long term, that would turn into respiratory acidosis. We could do a sputum culture to determine specifically what's infecting the lungs. On a chest x-ray, we would see consolidates, and on a chest CT, we could also see symptoms. Management pharmacologically would be to provide oxygen with careful observation and to provide humidification. We could provide a bronchodilator through nebulizer or a meter dose inhaler. And we could provide antibiotic therapy or other types of therapy depending on what the infectious agent is. As far as nursing care goes, we would do an assessment, medication administration, educate them on incentive spirometry, coughing and deep breathing. We would do postural drainage and repositioning, chest physiotherapy to help break up some of that fluid that's sitting in the lungs. Mobilization will also help break up that fluid. We would monitor their eyes and nose and nutrition, and teach them energy conservation. Complications of pneumonia is it can become necrotizing. We can see a buildup of fibroids and scarring of the lung tissue, which decreases compliance. The patient can develop pulmonary hypertension, and there are increased risk for meningitis and sepsis. Some main nursing problems would be poor tissue perfusion, ineffective breathing and respirations, impaired gas exchange, impaired mobility, and risk for confusion. As far as nursing assessment goes, we would want to focus on vitals, neurological status, respiratory status, cardiovascular, especially related to gas exchange. We would do lab and sputum testing and measure eyes and nose. Our education would focus on infection prevention techniques, minimizing the spread, providing medications, helping with nutrition, and encouraging vaccination with the pneumonia vaccine. And that wraps up our Med-Surg Mini on pneumonia.